Before going into this presentation, I'm going to give a little background on what this project is about. So the project is just about the dementia. And the fact is that there was this G7 or G8 and health ministries took place in England last December. And there the ministries declared the commitment to respond to emerging problems of the dementia across the globe, and then especially in the G7 countries, and by focusing on innovations and some treatment options, and innovation, and as well as summarizing some of the innovative care models across the OECD countries. And that's why the OECD was being called upon to work a little bit on this, summarizing and reviewing some policies across the countries to basically present at some of the one of the follow-up events related to G7 summit. So there are two related events happening very soon. One is in Toronto, Canada, and I think it's in September, and that's more focusing on big data for dementia. And the another one is going to take place in Japan in the first week of November, and that's when we are going to present the finding of this project on dementia and on summarizing innovative care and best practices on several aspects of dementia care and prevention, actually. So this is still sort of ready to be submitted to countries, but not yet completed. So I am going to present. Actually, sorry, I have to time myself. I forget. Sorry, I totally forgot about it. Most important. Sorry, I'll do it. Thank you. So here I'm going to show you several aspects of policies that governments have been introduced to improve responses to dementia care and the people to the caring of people with dementia, and then also their family members and so on. But I very much welcome your comments, criticisms, and reviews, and you name it, because this is a very important area of work, and then you're the experts in many aspects in long-term care and aging care, and we hope that we can put together some very interesting policy recommendations. So first, I'm just going to start with why dementia is becoming such an important policy area. First, obviously, the dementia is very much linked to mortality and mobility. In the OECD alone, the dementia has been a problem, not only just mortality, and so in 2009, about 14 million people are estimated to be suffering from dementia across OECD, and that's the estimates suggest that about 100 million people will be suffering by 2050, and you probably would expect that dementia is one of the most leading causes of the burden of disease for the people over 60 years old. And this chart is sort of the only chart that we collect for the OECD data collection, regular data collection. And this is sort of misleading because just to note it, that the dementia is not the primary cause of death usually. However, as you can see, the dementia death is increasing, and it's probably underestimated. Because of the fact dementia patients probably die from some other comorbidities. But just to note, and the aging society, because OECD countries are aging, as you know, and aging is the strongest predictor and a factor for dementia prevalence, and this is related to the age. With that's leading to a greater need for care services and cost overall at country level. And as you also know, probably that the long-term care and then the caring of people with dementia, it's a very labor-intensive work, and there is little productivity gain at the moment. Because of this, the total cost would increase as a proportion of GDP. And this chart is not only the dementia cost related, but it is the projection model, the result of the projection models that's regularly taking place at the OECD on health and long-term care expenditure. And this is probably, just to give you a very quick, because it's not I just want to move on to policy responses. But what it means is that there are several scenarios: cost pressure scenarios, normal scenario, the base scenarios, and cost containment scenarios. And you apply that, and then basically you ended up noticing this is the range of the increase of a percentage. The point increase in total health and the long-term care related expenditure, and the lowest, the best case scenario would be the about 2% increase, and the maximum is 8% increase in Germany. And overall, the OECD countries, as well as some of the non-OECD countries, are expected to increase the expenditure on health and long-term care up to 8%, and for some countries would expect about 10% point. And then we have this project where we have disease on estimating expenditure on disease, and we have this cost estimate on dementia only, and we have data from the Netherlands suggesting that already over 5% of the health expenditure is being already spent on dementia care only for 2009. Now I'm going into the countries, what countries are actually doing to respond to the challenge of dementia, and these are more related to policy. So I'm going to show more about the policy messages that we are going to suggest to countries. The following slides are going to be divided by segments. So we're going to look at the care pathways or care path for the dementia care, starting from diagnosis, so detection and diagnosis, and the people who've been diagnosed, would they have access to care, the appropriate care? And looking at the third point is looking at if the person is being diagnosed, how are they actually living with dementia, either in the community, in the institution, or home care, until the end of the life, and then looking at the policy responses to provide care for those with dementia at the end of life. And there are several cross-cutting themes, such as workforce issues and informal carers. How do you support informal carers or recognize them? And then making sure that a living environment is suited or adapted for the needs of the people with dementia. And finally, how can technologies actually improve the quality of care of the people with dementia? So I'm going to start with diagnostic testing. First, basically, what we have, as Dr. Martin Knaps yesterday mentioned, that it's a very sensitive area, and diagnostic so early detection. Well, first of all, there is no cure for dementia at this moment, and many countries in the OECD actually recommend in their national strategies the early detection of dementia is the priority for their countries. However, there are several advantages and disadvantages because of the fact that people would be perhaps more benefiting from knowing their symptoms and understanding what they can do with the symptoms, and they would probably can seek for medical therapies and psychological interventions as much as they can gain And then also the informal carers, so the family, including family members and so on, family members and friends, can understand how to better respond to the changing behaviors of the people with dementia. And then also one important part is if there is any need to appoint some legal attorney or not for the designate, for making sure their voice will be heard. And finally, they can be directed or referred to appropriate services, including long-term care services. However, there are quite a distinct disadvantages or dismerit for early diagnosis, because of the fact that early diagnosis or early detection might risk overdiagnosis and also increase stress related to diagnosis among the people with the people and also their family members. And Martin also mentioned yesterday that the social stigma is quite strong in communities. So being diagnosed with dementia still, people would suffer from some stigma related issues unless the society has more different attitudes to accept them. And what is really important is, what is really missing actually is that even if they're diagnosed, their access to care is not always guaranteed. So one point is that they'll be diagnosed, but perhaps because there is no treatment and the physicians might not be very incentivized to refer them to different services, the diagnosis is the end of the point and they'll be let alone outside. So at this moment, our recommendation basically is that there is no rationale for population screening. However, what's important is diagnostic testing should be available for those who feel, who are concerned about their symptoms, and at the point of, and that's the point when they should be receiving diagnostic testing for clarity. So for those who are seeking treatment for better understanding their symptoms, usually GPs or family doctors are the first point of contact, and they're the ones actually provide some diagnosis and refer patients to receive further diagnosis. And that's the case in Italy, England, and France. Many countries do not actually require full diagnosis by specialists. So Japan, for example, needs assessment is provided, and that includes some components to test to diagnose the dementia symptoms. And once they're being diagnosed, that they're not required to refer to the specialist. And because of that, the training of primary care staff has been sort of the part of the dementia strategies in countries like France and Australia and Japan. And because of the fact many literature has been pointing out that the physicians are not well aware, physicians and nurses in medical services are not always trained and aware of the characteristics of dementia patients, and that causes a lot of underdiagnosis of the people and referring to wrong services. And also GPs can play a very important role in post-diagnosis services and care coordinations, combining medical services, so physical therapies, the medications, and also coordinations with social care or long-term care. The OECD countries very much, according to the surveys that we carried out recently related to this project, all mention, and then also for the past project on long-term care, all prioritize to keep people with the long-term care needs and the dementia remaining at home is the most desirable option. And also they are prioritizing to make sure that the availability of home care services is ensured for those who wish to stay at home. And most OECD countries There's, for example, in Australia, 30% of people with dementia live in care accommodation, while 70% actually live in the community. However, the surveys, this 35% and 10% on the first two bullet points, are based on the Alzheimer Europe that conducted, the Alzheimer in England, that conducted survey of the people with dementia and how often they can actually get out themselves. On the survey, according to the survey, 30% only with people with dementia said that they leave home only once a week, and then 10% are not even able to get out or go out more than once every month. And this is a particular concern that comes from Japan, that Japanese society or Japanese government is very concerned about the people with dementia who go wandering to their communities and lost their way to go home. And that they started collecting the data on how many people are actually being lost, there's also sort of services that's available from the police station, identifying, registering them by the family members to make sure that they will be identified if they're being spotted on the street. Responding to that, there are many countries promoting and encouraging societies to change to be more dementia friendly. That's just examples come from Netherlands, England, France, and so on. And this includes sort of the training. Yes, please. Oh, okay. Training of people, including not just the adult populations, but also the people, the children, and so on. That can be included in education and so on. Now, care coordination is particularly important for people with dementia. People usually have more complex needs than those other people, and less able to navigate multiple complex systems at different levels of setting. And fragmentation of care exists across different care settings and between health and long-term sectors, and also between state, local, and municipal levels. And as you know, that some of the preventable emergency department visits and hospitalizations occur because of the poor care coordinations and fragmented systems. I'm just going to focus on care managers. So care managers are being introduced to help them navigate different systems in different societies. And one example comes from France, the program called Maya, and Japan also has care managers, and many in England the same. And the positive outcome is that one person can follow up with a patient, with the person with dementia and relative, and making sure that their voice is heard, but at the same time making sure that care plan is being well coordinated. However, there are quite a few different shortcomings. So one is the care managers are not always recognized by medical services, and there's no standardization of qualifications and among the care coordinators, care managers. For nursing homes, institutional capacity in treating and managing complex conditions have grown. And what it means is that the people with dementia the people living in institutional care tend to have more complex needs in terms of long-term care, and also in terms of the degree of the progression of dementia. And just an example, 50% in the US up to 70% all have dementia conditions in institutions. And some examples have shown some positive outcomes for the caring of people with dementia. Small-scale units, home sharing, better access to medical care, it's been very important, and also the accreditation to adopt nursing homes for the need, especially for the people with dementia. For informal carers, it's a very big challenge. I'm just going to go quickly. The informal carers, they tend to have more worse outcomes in terms of mental health and employment opportunities. And without the adequate support, because of the shift towards community care, informal care's burden is going to increase. So what kind of country can do is to provide some acknowledgement and recognitions and support through providing leave from work that help not unemployed or providing respite care, counseling and training, and then also recognizing them as a professional by providing care allowances or care cash for care recipients. And in terms of medical need, they would need more significant medical care, and then they are frequently hospitalized. And providing medical care outside of hospital can actually reduce the risk of hospitalization. And some of the examples are here. The on-site geriatrician in the Netherlands and adjusting hospital setting by giving acute care evaluation in Australia and hospital care in a intensive setting. In terms of the information system, there's, as I mentioned, the fragmentation system across different settings. And one I just want to point out is dementia registries in Sweden that basically tracks people, that allows following up with people who've been diagnosed with dementia throughout the system. And that's been shown some progression, and that's been some positive outcomes. And then the end-of-life care for people with dementia, so palliative care is increasing use. However, most of the palliative care strategies still fail to mention specific conditions related to dementia, and that has been sort of the outcome that needs to be more done. Now, the quality of care is definitely one aspect that needs to be addressed. And there are three ways. One, choice and preference, and then making sure that abuse and neglect are avoided, and some of the innovative approach to incentivize providers by providing some financial incentives. And care workers standard is also, there are several countries expanding standards to make sure the qualification of long-term care workers are improved and ensured and more standardized, and minimum curriculum requirements are increasing, and some countries also introduce dementia-specific curriculum and also training opportunities for long-term care workers. And finally, this is the last slide, and this is something more to do with Japan, because Japan is very much interested in introducing robots. And I think France is also following the steps a bit. We have not seen much cost effectiveness in this area, and I think some of the speakers already mentioned yesterday. However, we will still find some ways to introduce this, because there are several small aspects of device that can really help change the life of the patients with dementia. And this is the end of my slide, and thank you so much for your attention. So I just went very quickly, but if you have any questions or clarifications, please.
Raphael Wittenberg, NSC. Can I ask where the OECD program of work is going and what your objectives are? You mentioned the G7 in Japan. Is that the main target audience, or is there a wider program that you're planning?
Well, so this is... It's very relevant, yes, it's a relevant question, thank you. So you probably noticed that most of the examples are coming from G7 countries, and with some exceptions of the Netherlands and so on. What happened is for this project, until November, we're focusing a lot on G7, where we're going to continue working on dementia. And we're going to combine this aspect of big data, so information infrastructure, and the innovative dementia care practices for the next year. Well, actually, for the next 2 years. We are going to work on this project for the next 2 years. then expanding or including more countries in the project to be more comprehensive and appropriate and relevant to the countries. Because right now this is a very short term project that's more aiming to submit to this legacy event in Japan, and a focus with only on 7 countries, but there's more interest from the rest of the OECD countries and then also some other non-OECD EU countries we're going to work on the next years. All right. Well, thank you very much again.